connecting you to our community, 11 Connects. Welcome to 11 Connects. I'm your host, Jen Lennon. Today I'm joined by Dr. Abram McBride. He's a urologist here in Colorado Springs. Welcome, Dr. McBride.
Thank you, Jen.
I'm so glad to have you here right now as we are dealing with this pandemic and this very stressful time that we've all been through the past few months. And certainly that can take its toll on relationships. What are you hearing from patients? What are people noticing that they might not have noticed before?
Absolutely. I think for a lot of couples, there's been a huge change in their daily routine, whether it's one of the partners or both partners working remotely from home, or perhaps they were furloughed from their job or lost their job. And in either case, I think there is that stress along with the stress of the pandemic that we're all dealing with that may have uncovered some issues in the bedroom. And then you have the issues in the bedroom that mix in with the other stress, and it really creates a frustrating situation for many couples.
Right, you kind of get in a cycle. And I know that stress can certainly impact erectile dysfunction, but that's generally not usually the cause. Is that correct?
Correct. I think stress is something that can bring attention to the erectile dysfunction, but in most cases, there's an underlying medical condition that's the real cause, whether it's diabetes or heart disease, or even the side effect of a prescription medication.
So that's why it's critical to get to your urologist, to get to a doctor, to get to the cause, and then to the options for treatment. And that's the hopeful part. So can you emphasize there's a range of options, correct?
Yes, there are. These days, folks can get an internet consultation and have medication shipped to their house, which I think is an easy way to get treatment. And usually that's an oral medication, which can work well for mild to moderate symptoms of ED. But for patients who have severe symptoms or the medications are not effective, there are other treatment options such as vacuum devices, penile injection therapy, or the penile implant. And it's critical to have an office consultation with a urologist, men's health specialist like myself to review all those options with the couple.
Now, you have found the penile implant to be incredibly successful. Can you describe that to us? It's a surgical procedure, but a minor one.
Correct. It is a procedure. It's outpatient, and the risks are very minimal. In most cases, it's limited to some bruising and swelling that resolves within a couple weeks. But the satisfaction rates are very high. 98% of couples are very happy with the end result. And of all the options that I've mentioned, it's the only option that provides a permanent long-term solution for the problem.
And so does that provide some spontaneity then again?
Absolutely. I tell couples it really sort of takes them back to where they were in the early days of their relationship, where they were focused on each other and just being spontaneous whenever the mood was right, as opposed to being focused on, well, is this treatment working or that treatment working? And then it brings the partners away from each other, which I think is not what we want.
And you said a permanent solution. How long can the implant last?
Yeah, these are mechanical devices. They typically last 12 to 14, 15 years, but of course at some point it will need to be removed and replaced.
Got it. And so I know that there's a lot on the internet people can read, and they might even want to just look at something themselves, but starting a conversation with an expert is critical. It may be uncomfortable, but how do they start, Dr. McBride?
Absolutely. Just go to our website or call our office. We're happy to see patients. We are taking all the COVID-19 precautions. We're wearing masks, cleaning rooms, et cetera. So we're trying to provide a safe environment for patients to come in and be seen.
And do you recommend partners come with patients if they're comfortable? Is that something you see often?
Absolutely. I'd much prefer patients and their partner come in as a couple, because that way we can answer everyone's questions and make sure we're finding a solution that works for both.
Got it. And so just a reminder then, go to the website, give a call, and they can book a consultation.
That's right. Thank you.
Thank you so much, Dr. McBride.